Good morning. I'm speaking to you today from the traditional territory of Treaty 6, and I'd like to acknowledge the Métis people of Alberta who share a very deep connection to this land. I'm pleased to be here with our whole health team, MLAs Laurie Sigurdsson, Luann Metz, Janet Eramenko, and David Shepherd. Today, we're sharing some documents that came into our possession recently. And I'll be completely candid about this. They showed up in the mail. I don't know who sent them to us. There are 35 pages of cell phone pictures of a presentation to Cabinet describing in detail the UCP's scheme to tear apart Albertans' public health care. We have a lot of questions for Danielle Smith and Adriana LaGrange, so let me get started. This is a plan to massively concentrate control of health care in Danielle Smith's office, but in the real world, it is in fact a blueprint for chaos in our clinics and our hospitals across this province. Now, any of those UCP members who cheered for more rural or local decision-making in healthcare at their AGM this weekend is about to find out that they've been brutally double-crossed. None of that kind of thing is in here. Instead, what we see, Danielle Smith's actual plan is to concentrate control over healthcare decisions in the Minister's office and the Premier's office. But what will actually happen is catastrophic chaos. Now, if you think that's an oversell, let me list the new agencies this plan creates. The Primary Care Organization, the Acute Care Organization, the Continuing Care Organization, and the Mental Health and Addictions Organization, each with its own transition board, an integration council, a Center of Recovery Excellence, and System Transformation Office. And my personal favorite, the Procurement and System Optimization Secretariat. Talk about a name only a bureaucrat could love. But more importantly, I expect this is the place from which the UCP will launch most of their plans for privatization. Here's what we know is not in the plan. No new doctors, no new nurses, no new paramedics, no new nurse practitioners, no new LPNs, no new health professionals. But there will be entire new office floors filled with people at computers trying to figure out what the heck it is the UCP wants from them. Now, I strongly suspect many of those folks will simply skip all of this altogether and pursue their careers in other provinces. Let's take a look at some of these new bureaucracies. On continuing care, the plan is to create a government agency that contracts with private agencies to provide care. That used to be something that AHS does, no more. This will lead directly to the sell-off and privatization of Capital Care and Care West, and the 24 buildings which are home right now to almost 3,000 vulnerable Alberta seniors. Mass privatization of seniors' care has long been a UCP goal. It is described quite openly in the EY report commissioned by the UCP back in 2020. So what does this mean for seniors? Well, it means that their quality of life will get considerably worse. Now, we've known for a long time that private operators do everything they can to cut costs and cut corners on food, on staffing, and on care for seniors. During the pandemic, seniors in private facilities suffered more and died more than seniors living in publicly run homes. This is a plan to force everyone into more dangerous privately run seniors facilities. Now, on primary care, there's not a word about how to hire more doctors or keep the ones we have. In fact, the document itself, in that document, the government complains that there are actually too many doctors. There's also lots of language like all publicly funded providers and clinics will be accountable to the primary care organization. And again, this primary care organization is in fact the government of Alberta, directly answering to the minister and through her, the premier. After 4 years of living with this abusive government, I imagine that many Alberta doctors will not welcome this particular development. On mental health and addiction, whoever wrote these slides complains that AHS programs are sometimes running, quote, counter to government direction, end quote. This is bureaucratic language to describe that doctors and nurses are doing what is right for their patients, even though the UCP wants to deny them health care or offer a different type of health care. This isn't speculation. We know of AHS harm reduction programs that were hours from being launched before the UCP minister, Jason Luan at the time, reached in to cancel them. Now, we're heading down a very dangerous path when we allow politicians to decide on healthcare treatment methods. Let's put addiction aside for a moment. Health ministers don't know how to treat cancer. Their job is to make sure that the people who do know how to treat cancer have the resources and support that they need. Once politicians start deciding how to treat medical conditions, we're in a lot of trouble. So lastly, on acute care, there is no recognition of the biggest and largest problem right now, which of course is a catastrophic shortage of healthcare workers. But instead of trying to get more doctors, nurses, paramedics, and other healthcare professionals to the bedside, this is a plan simply for more direct control of those workers from the minister's office. I suspect this new UCP agency is also going to be tasked with setting up the private hospitals that the UCP has explored in the past. What's more, Danielle Smith has spoken openly about making AHS compete with private hospitals or private hospital businesses, and I'm pretty sure that this plan is heading in that direction. Listen, this idea that we can pull everything out of hospitals and just focus on acute care is totally out of touch with reality. Anyone who's spent any time waiting for the ER knows that many of the people who need help are there because of mental illness or substance abuse problems. And other patients will be arriving from continuing care facilities or being discharged to them or staying in hospital while they wait for the right level of care to be available for them in continuing care. This is the integrated nature of modern healthcare. But this backward-looking UCP plan will stuff patients and providers back into ineffective silos. Imagine a senior living in a continuing care facility who has to be taken to hospital because of a mental health condition. Under this plan, that poor senior is being tossed between at least 3 different government agencies, if we're lucky, if they're not privatized yet, under 2 different ministers and several contractors all on top of that. So who is truly responsible for that Albertan's health now? And who is accountable when this inevitably goes wrong? The UCP is creating barriers for patients, not pathways to care. Now, as I've said, I've seen quite a few of these decks, and I always make sure to flip to the back and look for the slide called risks. The top risks identified in this deck are potential to fragment care and delivery, end quote, and quote, risk of service disruption / failure, end quote. Those are some massive risks. Fragmented care and service disruption put patients' lives at risk. And in my experience, public servants usually put the mildest version of the risk in writing on the actual slide going to cabinet. To see language like this in a formal presentation is striking, and it is disturbing. System failure, that's what they talk about. It's clear to me that many people in healthcare can see this train wreck coming. And clearly Albertan, who put their career on the line to bring this scheme to the public, thought so too. So here we have massive, radically disruptive change, putting Albertans' lives at risk. And for what? Who benefits? Patients are forced to navigate 13 new agencies, boards, or councils, where there used to be 1. Rural communities get absolutely no new decision-making powers and no new doctors either. Healthcare workers just desperately want some help, and they want some more people working beside them. And those healthcare workers who've given so much over the last few years, who've been so distraught, who have pushed to the very edge, and who are still at work in Alberta helping their fellow citizens, what they are now facing instead is yet another onslaught, an onslaught of chaos from this UCP government. And my heart goes out to these working Albertans. It truly, truly does. And lastly, this is clearly a scheme to sell off and privatize public health care piece by piece. That path is clearly described in these slides. So who benefits? Well, from what I can see, the only person who benefits from this is Danielle Smith, who is giving herself sweeping powers to reach into any part of our healthcare and override medical professionals. It is deeply worrying to me that someone like Danielle Smith, who is so willing to gamble with Albertans' lives, someone who thinks Albertans should try horse dewormer to cure respiratory illnesses, will have direct control over Alberta's doctors and nurses. I believe that healthcare does need reform through direct investment in frontline care and a massive recruitment and retention campaign. That's not what the UCP wants to do. This is the opposite. Bottom line, this is an attempt to concentrate control of healthcare in the Premier's office, but it's actually going to cause catastrophic chaos in our clinics and our hospitals. The debacle with lab services and the recent food inspection in Calgary are the most obvious examples of their utter incompetence on these matters. So that's what we have for you. Thank you for being here. Happy to take any questions you might have.
Thank you, and we'll start with questions in the room.
First question for Ben. How many questions do I have?
It's over there, yeah.
You're good? I'm good? Okay. Taking the politics out of this, so what we have here is they're going to change a system where AHS runs this, and we subdivide it geographically, and now we're going to have 4 ministries that report directly to the government, not by geography, but by specialty. So just taking the politics aside, what do you think of this organizational plan? Because you say it's chaotic, so maybe you can expand a bit on that.
Well, I think there's a number of different elements to it over in an overarching way, because of course we could talk about this for hours. We used to have an arm's length independent board that managed our healthcare in Alberta. What this does is this brings that work back into the direct control and influence, scope of influence of the Ministry of Health, and through her, the Premier. So it's the first thing that happens. Second thing that's happening is we are creating silos, multiple silos of care across the province. Third thing, as you rightly identified, is there's nothing in here that actually addresses the concern that Smith talked about during the election around creating more regional decision-making agency for community members outside of the big cities. And thirdly, it cuts the system and fragments the system so much, I believe it's setting up large swaths of it for privatization. You see a specific mention of that in the slides. But in addition, I think when you look at the acute care slide, I think what you're going to see is the very stripped down version of AHS, the remnants of AHS, being told that they have to compete to run hospitals with private hospital companies. And then different hospitals will be run by different groups. So it is chaos. It is high levels of chaos. This UCP government has undermined the quality of care received by Albertans systematically over the last 4.5 years. This plan will take that reduction in care and accelerate it in a way we've never seen. And then they will claim that the only answer is to bring in the private sector.
And what about AHS? Essentially, in this redesign, they've been reduced to the role of hospital administrator, effectively.
Yes, AHS has been reduced to being one of several types of agencies that will run individual hospitals. And at the same time, what we don't know is how you're supposed to run a hospital when one board handles mental health, another board handles seniors care, another board handles hospital care, whatever that is left to mean, and yet another board handles community and primary care. I can't even imagine. I mean, we're setting up the hospitals for failure before we even leave the room.
Can I just clarify? They're saying the Integration Council will solve all these problems.
So this, honest to God, it sounds a bit like a Monty Python film when we start talking about the Integration Council, and I'm sorry for everybody under the age of 40 when I mentioned that. So, listen, it sounds like a bureaucratic layer that will exist as an explanation for why nobody is allowed to make decisions, but will not have the capacity to fix the problem. The people that are expected to sit on the Integration Council are ministers, elected ministers, and high-level provincial bureaucrats who really, from the sounds of it, come to the table with very, very little healthcare experience. So this idea that they will be able to untangle the mess is ridiculous.
Just for specifics, can you outline like real proof from this report that it's 100% means privatization? Just the specific examples where you think that is what they're leaning towards.
There's two examples where it's specifically outlined. One, when you talk about the Procurement and Systemic Optimization Council, that specifically is about finding private contractors to do work that has historically been done by folks who are part of AHS. The second piece is where they talk about selling off Care West and Capital Care under the Continuing Care Organization. So those two places specifically refer to privatization. However, when you look at the stripped-down role that they see AHS playing, and you see that they refer to AHS, Covenant Care, and other private providers being responsible for the provision of acute care, and then you pair that with what the Premier has said in the past about making AHS compete for hospital contracts, I suspect that that is what is being set up there.
Just for clarity around, I guess, your stance on things, you know, we see a lot of times with politics, all politicians are quick to point out what the other team's doing wrong, but a lot of times you don't hear about what, you know, the solutions. It's no secret that there's a problem in Alberta with healthcare right now. We're seeing it right now. 2 hospitals are literally turning people away. They can't have people in their emergency room. So I guess I'm confused because I feel like over the years we've heard a lot of politicians talk about, hey, we need to spread out, we got to spread out mental health. It's separate from this type of care, and you know we need more help. And right now you just said we can't have these people on boards because they're not medical experts, but we don't have a lot of medical experts right now in our province. So, like, I guess you're saying that there's no solution from what they're saying, but like, what else can people do at this point, or what do you suggest to solve the major problem we're having right now?
I suggest we devote more resources to recruiting, retaining, and training more healthcare professionals. The fundamental challenge facing our healthcare system right now is a lack of healthcare professionals. Having a government step in, blow up the system within which they are working, pretend that they are doctors, and create nothing but chaos is a recipe to do one thing, and that is to push even more healthcare professionals out of Alberta. So there are solutions. We have a very long and detailed proposal that we rolled out and talked very openly and honestly with Albertans about during the provincial election, and I invite you to check that out in the course of putting together your report on this. What happened during the election is Danielle Smith did not talk about healthcare. She refused to talk about healthcare. She did not talk about these ideas. She didn't consult on these ideas. And instead what we are doing is creating a level of, or a layer, or a level of chaos, which is going to interfere each and every day with the ability of frontline healthcare workers to provide the care they know they need to provide.
I feel like in its essence, part of the reform is about making AHS more manageable, more localized. Do you think that the AHS has gotten too big in the last 50 years?
Listen, there are ways in which to ensure that AHS is more responsive to community concerns, but by siloing all the different types of care and creating multiple levels of administration for each individual hospital, understanding the degree to which healthcare in this province is currently integrated, this will create nothing but chaos, artificial barriers, and just the inability to provide care. And so the answer isn't, dealing with beating up AHS because it's a convenient political talking point for right-wing members of the UCP. The answer is looking at where we need resources and dedicating resources to that. And there's lots and lots of information about how we can do that. But this isn't that. This is a restructuring in order to beat up on an agency as part of a talking point, at the same time creating massive chaos and uncertainty for the 250,000 frontline healthcare workers who will be impacted by these decisions, and literally having their employers changed out from underneath them.
Yeah. And about these slides, which steps did you take to make sure that these were the real deal? Because we're supposed to trust you, and
Right.
I need to trust you. So.
I urge you to go to the provincial government and ask them their view on it. We can't, as I've said, they came to us in a brown envelope. I have seen cabinet presentations in the past, and this looks a heck of a lot like a cabinet presentation to me. It's structured like one, and it strikes me. And I will say as well that we've also heard from some experts in the field that this sounds like exactly the kind of thing that they have been consulted with on in bits and pieces of it. So we expect it's true.
And just to follow up on that idea, I've been around long enough to know that when governments get these things leaked, they say it's just a draft plan. There's nothing actually in concrete. Now, some of the stuff, of course, does jive with what she said in the past, even last weekend, about splitting up AHS. In fact, she used the word
Disaggregation. Yeah, I know. Yeah.
AHS. So if they come out and say, this is just an idea, it's a draft plan, this isn't where we're going to go for sure, what do you say to that?
I will say I don't believe them. We have heard from some folks that they plan to start moving forward this as early as this Thursday. This may or may not delay it. I hope it does. But this is a highly developed set of plans that are in here. Not thoughtful, but certainly lengthy, and there's a lot of it. And we have heard from folks inside the system since receiving this that this jives with the pieces of it that they have been consulted on. So I believe that this is the plan. But I invite them to tell us that they are not going to go ahead with this plan. Indeed, that's what I'll be asking the Premier today, that they're not going, that she commit to not going ahead with this plan.
And if a follow-up, this is actually the plan. Do you see it in a sense going beyond ideology? This is a continuation of her UCP leadership race promise to disband AHS, get rid of Dr. Dina Hinshaw, Bill 6, take control of the health system during a pandemic. Do you see it in that light? This is going beyond just conservative ideology into her taking revenge, in a sense, against AHS?
Well, I think that this is, I think the two are one and the same, Graham. I think that what we're seeing here is a manifestation of a conservative plan to advance privatization at every possible opportunity. And at the same time, it does, in fact, echo a lot of the things that we have heard Danielle Smith say in the last 24 to 36 months, which we raised repeatedly during the election, which she said she had abandoned and that she was walking away from. I didn't believe her then, and I don't believe her now, and I do believe that there is, through this plan, the opportunity for Dr. Danielle Smith to walk into the room and start making decisions about what kinds of treatment people do and don't get, as well as, of course, enhancing the privatization and the fragmentation of our healthcare system.
Go to questions on the phone now. Just a reminder to press *9 if you're on the phone, raise hand function if you're joining us via Zoom. If you could say your name and your outlet, we'll go to our first caller.
Two elements in these slides that I wanted to ask you about. The first one is their estimated transition cost is $85 million over 2 years. I wanted to hear your thoughts on that price tag.
I think it's complete make-believe. I mean, They argue that that's roughly what it cost. That's part of the cost that was incurred around the establishment of AHS 16 years ago. So I suspect that $85 million is not actually the full cost of the transition to AHS 16 years ago. And so I suspect that the idea that this is the actual cost now is ridiculous.
Any follow-up?
Question two is about on page, whatever the 30th page of these slides is, it says that the idea would be to concentrate all control of public health. So I assume things that AHS does, like restaurant inspections and so forth, all under Alberta Health by 2026. What do you think the implications of that would be?
Well, I think the implications, particularly when paired with Bill 6, is that the UCP cabinet ministers are going to be making decisions about what does and doesn't constitute responsible public health efforts here in Alberta. And I think that's very troubling based on some of the anti-science, conspiracy theorist laced assertions that we have heard not only from the Premier but other members of her caucus.
We got time for one more in the room.
One more, big more reporters.
Really?
I just want to explore more. You talked about this was supposed to be driven by empowering regional decision-making, and I agree. I can't find anything in these documents that gives them regions any power that they.
No, it's true.
But it does say, it does incent them. It does incent the four governing bodies to, it incents them, it urges them to seek it out. We have regional boards that will be able to fast-track recommendations. So there is a method for regions to have their voice heard. Is that not enough?
Well, I guess you'd have to start by asking all those folks in rural Alberta who were demanding more agency whether the simple restatement of the previously existing regional advisory councils along with encouragement to these agencies is enough. I suspect they would argue, well, that's been going on since AHS started and it hasn't worked and there's nothing about this that suggests any big change. So all I would say is that it seems to me like if I were a Conservative member focused on that particular issue, I would feel like I'd been the victim of quite the double cross. But yes, there's no question. I think the only place in it that it talks about regional agency is where they talk about the regional advisory committees, which frankly already exist. And to listen to many folks in rural Alberta, they would say that they are completely ineffective. And quite frankly, if those regional advisory committees are now being told to bounce between 4 different agencies, each of which, of course, will tell them that it's the other agency's responsibility, I suspect that they will throw up their hands in despair and walk away from the effort.
And final question will be a double-barreled one then. What's not in this thing is that they say it's going to affect 250,000 workers, but it doesn't have any discussion of job creation, job losses, job reapportionment, that sort of thing. So what do you think about that? And also, as far as I know, the Premier's still supposed to have an event with Tucker Carlson in January. What do you think of that?
Okay, well, that is quite the double barrel. So let me say, as I said at the outset, it was incredibly revealing to me that this document doesn't talk at all about structural efforts to recruit, retain, and develop more of a frontline healthcare workforce. In fact, this whole thing is going to be rolled out, and then folks are going to be invited to hear about it after the fact. So it's incredibly disrespectful, and it is going to actually, I suspect, have the effect of driving folks away from the workforce. In terms of Tucker Carlson, listen, that character has attacked the Ukraine. He has diminished women in an offensive way. He has endorsed the attempted uprising in the U.S. around the presidential elections. He is not a credible figure. The fact that our Premier believes it's appropriate to normalize the things this person would say by appearing on a stage with him, it demonstrates a profound lack of judgment on her part. Furthermore, it damages Alberta's reputation on an international level at a time when we are trying to present ourselves internationally as a safe destination for investment dollars. So I would call on the Premier to immediately cancel that planned appearance because Albertans deserve better from their leadership. They deserve responsibility. They deserve a measured form of leadership. And appearing with that character on stage is not that.
Thank you, and that's all for today.
Thank you.